Hello, 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 hello. Good evening, fellow friends and loved ones. Yes, it's once again a very great privilege to come to your homes this evening. Yes, it's the 7th of March 2021. Yes, we acknowledge the fact that there has been a massive power outage throughout the country, and and despite that, we come to your homes to present to you our weekly health discussions on various health conditions. And I'm sure today is not an exception. And we will enjoy this presentation this evening. Yes, I'm sure you can see me sweating a little bit. Yes, it's because of the power outage, and then there's no much um, uh, um, um, air here. So we continue our weekly discussion. So our outline for today's presentation is actually acknowledgement, a quote, definition and description, the prevalence, a clinical presentation, primary risk factors of the condition that we're going to talk about today, the possible risk factors, some warning signs to go to detect this condition, and the stages of this condition, the associated comorbidities, the medication that you can take, the diagnostic tests, the biomarkers, how we can identify this condition, and the various tests, neuroimaging that we can use to notice this condition, genetic testing, some screening tools, the causes of this condition, the systemic involvement, the management, be it medical, physical therapy, dietetics, that is dietary management, and then the differential diagnosis, how to differentiate this condition from other various conditions. So we start today with a quote which is very important that we need to take note of. It states that success is the sum of small efforts repeated day in and day out. So that's the quote for today. So we take as a food for thoughts for today. Success is the sum of small efforts repeated day in and day out. So we start this topic. Yes. So our topic is titled Alzheimer's disease. Alzheimer's disease, or we can say forgetfulness and confusion. Yes, so it's actually a condition that affects mainly the brain. So the brain actually is seated in our head. Yes, a brain is a small rounded structure that is found in our head, that is our skull, that helps us to send information. It is the control center of our body. Without the brain, we can't move our hands, we can't think, we can't remember things, we can't store things, neither can we perform our activities of daily living very effectively. So our brain is a very vital component of our being. So we are talking about the condition Alzheimer's disease, presenting itself with confusion and forgetfulness. Yes, so actually this condition is a common cause of dementia worldwide. Dementia is a condition that it actually presents by forgetfulness, so where people don't remember things very well or very effectively. We can classify this person or this individual as having maybe an Alzheimer's disease or dementia. Actually, it's composed of two main presentation, where the person has very vast or mild memory loss. That is when you ask the person that, oh, maybe what did you eat this morning? The person cannot remember. You ask the person that, what did you eat yesterday evening? The person cannot remember. And then it continues for a while. Then the person is likely to have a portion of brain being affected, and this could be Alzheimer's disease. Okay, so actually scientists have classified this condition as a neurodegenerative disease or neurodegenerative disorder. That means neuro means involving the brain, and degenerative is actually a progressive worsening of a condition. So when we combine the two, neurodegenerative means it's affecting the brain and it's gradual and it could worsen with time. There has been a very important risk factor, that is, which is a possible risk factor of this condition, that is aging. So as we grow, as we move to the ages of 40s, 50s, 60s, 70s, 80s, 90s, the condition gets actually worsened, where we present with signs of this condition, which we'll be talking about very soon. Yes, so the main risk factor for this condition is aging. So as we age, we begin to show signs of this condition, and it's seen in pictorial presentation, that is imaging, various tests that we do from the brain. Okay, as we said initially, it's progressive. That is, the symptoms get worsen over time, and actually, per this condition, even outside, when you talk about the European countries and United States of America, have not found any cure for this condition. But there are other tests by various big medical institutions to be able to diagnose this condition. In fact, to effectively treat and find a cure for it. But as of now, there has not been any cure for this condition. And treatments actually are aimed at slowing down the progression of the condition, because when it happens, it could worsen over time. So scientists have found it that if they could extend the duration of time the person could have or to live with this condition, it will actually help to be able to allow the person live for quite a longer time. Okay, so actually this condition involves the brain, which we'll be seeing very soon, some pictures to show us the condition. Okay, so we're talking about anatomy also very soon. Actually, the pathophysiology, that is the disease itself, actually involves reduction in a particular part of the brain, where you have a component of the brain shrinking. So where they shrink, we have poor transmission of signals to various structures in the brain, and then it mainly involves a part of the brain we call the amygdala, hippocampus, and then gyrates and sulcus. So these are all scientific terms. I'm sure they are big terms, and it will find me difficult to understand. But very soon we'll be showing you some pictures to be able to appreciate this terms we are talking about. So some of the classical signs of this condition is that we have loss of brain mass. So the structure of the brain is like that. It has its width and it has its size. So where we have, looking into various machines such as MRI, we have a reduction in mass of a part of the brain. Then we can also draw our ideas, our thoughts towards this condition. And also we could have enlargement of the brain ventricles. The ventricles are structures that carry blood or they transmit signals through the path of the brain. So we have so many ventricles, and actually the ventricles also, they carry CSF, so cerebrospinal fluid, that helps to keep the brain also in its very good shape. And then it's very important to keep the ventricles in its normal state. So when they take tests or they take a picture and we have the ventricles in the brain being enlarged, then it could be that the person has Alzheimer's disease or presentation of forgetfulness or confusion. Okay, so we could have also brain tissue changes, which could also cause the person to forget things in a short term. So the person, if you ask the person, oh, what did you do about 10 minutes ago, the person can't remember. But then when you ask the person, what did you do 2 weeks ago, the person can remember. That shows how the condition has progressed. Okay, so we have some various technical terms that I just want to just place before you. We have the senile plaques, that is actually, we have presentation where we have, when you have high concentrations of this, a plaque is actually a mass that is from the brain. So when you have too much of them, then it could show that the person could have this condition called Alzheimer's disease. Also, in younger people, we don't have this plaque presenting. These are proteins that they form mass in the brain, and they prevent transmission of signals from one brain portion to the other. Therefore, we can't be able to coordinate and remember things very easily. We have also something we call neurofibrillary tangles, and these are found in very important structures of the brain recalled, I mentioned earlier on, as the hippocampus, the amygdala. We have the basal ganglia or nuclear basalis, and these actually are coordinated, so they work together to be able to allow us to remember things, to be able to perform activities of daily living very effectively. So when these channels of communication are interrupted by these plaques, they don't allow us to be able to function very well and carry out activities of daily living very effectively. So we have B amyloid, which dissolves in the brain, and then when it's absorbed, it prevents them to prevent communication of signals in the brain. And actually, these plaques are quite visible, so they become thickened and they fold themselves and they prevent communications from one portion of the brain to the other. So when these plaques are formed in the brain, they trigger inflammatory response. That is, if they form, it means that they are foreign substances that are formed in the brain, and the brain has soldiers in the brain which are produce inflammatory response. Inflammatory response means that they want to cause stability and everything, sanctity in the brain. So by producing inflammatory response, that is signals into the brain to cause the brain to function normal, they in turn cause damage more to the brain tissues, which becomes very worsened, and that is where the symptoms or the stage progresses from worse to worst. And so and medications, there are therapies and so many things that are started as early as possible to be able to diagnose and then treat this condition, and or we say manage this condition very, very effectively. Actually, these degenerative activities cause decrease in substances in the brain, and the brain also depend on hormones to be able to function easily, because when you have lesser amounts of hormones are actually substances that helps us to keep a good mood, to be able to carry activities of daily living very effectively. So they help also to keep us in a good shape. Okay, so just a brief prevalence of this condition. Actually, this condition is a second to the most prevalent condition worldwide, that is dementia. So after dementia, that is also affecting the brain, we have a condition we call, that we're talking about today, Alzheimer's disease. So in 2017, a study that was carried out in the United States of America said that about 5.5 million people in the world, yes, 5.5 people in US, United States of America, had this condition in 2017. But worldwide study stated that about 8 million people were affected, and then they are predicting that actually a larger number of people were affected in the year 2050. So and then they also stating emphatically that about 115.4 million people will be affected worldwide, as compared to the current state in 2017 that was about 5.5. That means that it could be triple or 10 times or even 100 times more than it's been recorded as at 2017. And statistically stated that about 6.6% of people have this condition, and the age range is from 65 years and above. So 6% of the population of the United States of America, that's America, have this condition, and they are within the age of 65 and above. About also 20% of people in America who are 80 years have this condition called Alzheimer's disease, presenting itself with forgetfulness and confusion. And also about 95% of the people in the United States of America who are 95 years and above have this condition. So it pre-states that, or it emphatically states that people who are 95 years and above in America have this condition. But in Africa, or specifically in Ghana, there hasn't been a very, very good study, or very, very laid down study about how prevalent this condition is in Africa, or specifically Ghana. So it's also stated by research that this condition is the sixth leading cause of death in adults in the world. Also, actually, this onset of this condition could last between 7 to 11 years. So just imagine if you are 80 years and you have this condition, scientists say that you could have a lifespan of plus 7 years or plus 11 years, because so far as the brain has been affected, there could be very, very, very fast or slow degeneration of the condition. That is without medication, but with medication it could extend to quite a longer time. And so anyone who has symptoms of this condition, that is, person could not remember things in a short while, or show some signs and other clinical signs that we'll be talking about very soon, the person should actually report to the medical doctor or a specialist. or any medical personnel so that we can assess him or her. Also, one of the very important studies state that 89% as compared to other top disease, 89% as compared to other top disease actually is observed to be in a decline because of the adequate treatment that is given outside, that's in the United States of America. So it's shown that with medication, with other therapies, this condition could, the life of the person affected by the condition could extend to quite a longer number of years. And so we have actually two types of this condition. We have the early stage Alzheimer's disease and then the late stage Alzheimer's disease. Alzheimer's disease can be classified as A and D, AD. So instead of me saying Alzheimer's disease or forgiveness and confusion, I can say AD. So when I say AD, I'm sure we could understand what I'm talking about. So actually this condition, the first type of this condition, that is early stage AD, that is Alzheimer's disease, spans from the years 30 and 60 years. So when you present with some clinical condition or presentation that we're talking about very soon, we could also say that within this age range, 30 and 60 degrees, you have this condition called early onset AD. And then the late onset AD actually occurs after 60 years. Actually accounts for about 90% of the cases. The early onset actually is not so prevalent. It accounts for about 1 to 6% of this condition. And then another important research stated that about 2/3 of Americans with AD, that is Alzheimer's disease, are women. Yes, one may ask, why are they women? Because women actually enter into their menopause actually quite early, so therefore they are likely to have this condition. But that doesn't mean that they are not going to live long. But then with management and with various therapies, they could live quite longer number of years. And actually showing that older African Americans and then Hispanics have increased likelihood of this condition. So if you are an African and you're an African American, you could have an increased prevalence or increased likelihood of having this condition. Okay, so we're looking at the clinical presentation of this condition. So how does this condition present itself? Actually, this condition is progressive, as we mentioned and we were talking about earlier, and it's continuous. And actually, it does not fluctuate or improve. It gets worsened over time. But with medications, we can have an improvement of the condition, and we could have less clinical signs presenting in the individual. And then, actually, the symptoms, early symptoms, when we don't really take note of it, you can overlook this condition, and then the symptoms actually could present itself as a worsening stage as time goes on. So we mentioned the primary risk factors in our outline, and so actually these primary factors are: one, advancing age. So when I say risk factors, it means what can make this condition actually present itself early. One is advancing age. So people who are 85 years and above have a 50% likelihood of having this condition, that is Alzheimer's disease. And actually it's actually genetic. So if you have a family member who has this condition, it's shown that in the genes of the person, when you say genes, the inner traits of the being of the person can give it to you. So it could pass on from the mother to the child, or from the grandfather to the grandchild. Yes, and it's actually involves some proteins in the body we call the apolipoproteins. And then these proteins, when they are transferred from the mother or from the father to the child, the condition also can be passed on. And it's stated that this involves a genetic mutation. That is, when the genes are transferred, that is when you give birth, we have something we call genes, and that makes us look like. So if you give birth to a child, your child looks like you. It's because there's something that we call genes, and when you transfer it from you to the child, it gives you that semblance, that is physically you look like the child, or the child looks like you. The same way that inside you there are some things within you, when they don't form, or that's when they malform, yes, they could cause this condition from happening. That we call mutation. Okay, so we have other conditions also that could also bring this condition called Alzheimer's disease very early. We have something called trisomy 21. When you have the hormones or the genes malforming, they could present itself in a child having a condition we call trisomy 21. Maybe sometime we're talking about it, and then we'll get a very deeper understanding of this condition. Actually, also it's shown that cardiovascular risk factors, so people with obesity, people who are overweight, past overweight, become obese, could have this condition. Also could have also people who have hypertension and hyperlipidemia, that is, we have high fat contents in the body. It could predispose the person or the individual to having this condition called Alzheimer's disease. That is what we mentioned earlier, that the hyperlipidemia could cause the formation of what we mentioned earlier on called senile plaques, and these plaques prevent transmission of signals from one portion of the brain to the other, and so this could bring the condition, that occurrence of this condition, earlier. So it's advised that we take in less fats, which will be talking about the management, the medical management, and the dietary management, and the physical therapy management. So also the possible risk factor of this condition is actually head trauma. So if you have had an accident that is involving your head, you hitting your head onto maybe a car seat, or probably an accident where you have had a head injury, you could have this condition called Alzheimer's disease at an earlier stage of your life, where we have moderate traumatic brain injury. Actually, scientists or research has stated that you are 2.3 times likely to have this condition at an earlier stage, and then when you have a severe form of this head injury, you could have about 4.3 times the risk of having this condition. Also, it's believed that there are some proteins in the body, that is the genes, that cause this condition to come or to occur at an earlier stage. So we have this protein we call the beta amyloid and tau proteins, and these cause this injury, that is this condition, to appear at an earlier stage. So other risk factors also include the history of depression. We could have progression of a condition we called Parkinson's-like signs. So we talked about Parkinson's disease the last week, and so if you have Parkinson's disease, you could have this condition called Alzheimer's disease. So they are actually friends. So if you have Alzheimer's disease, you are likely to have Parkinson's disease, or Parkinson's disease, you are likely to have Alzheimer's disease. So we need to just take into consideration your predisposing factors. And also, if you have folate deficiency, that you have low iron in your system, you could have also this condition. If you also have hyperinsulinemia, so we have something we call insulin. So if you have more insulin in your system, that is the fact that the insulin is supposed to ensure that you're able to control your sugar level, but if you have more insulin in your system, you could have this condition we call Alzheimer's disease. If you also have high blood pressure in your midlife, that is, as you mentioned, the early stage of this condition occurs within the range of 30 to 60 years. So if you have a high blood pressure in this condition, and so if you also have a hypo or hyperthyroidism, that is, you see people having goiter around their neck, a big neck around front part of the neck being big. The person could also accelerate this condition to occur, that is Alzheimer's disease. So how can we protect ourselves from having this condition called Alzheimer's disease? Actually, it's shown that also we have to take in a lot of fish, regular fish consumption. So these could help to minimize or prolong this condition from occurring. So if you have to have this condition occurring maybe at your 85 years, when you take in more fish, it could prolong it probably to 100 years. Yes, and also you also have to take in omega-3 fatty acids. So regular consumption of omega-3 fatty acids also helps to be able to prevent this condition from occurring very early. And also we also have to take in very minimal amount of sugar and then saturated fats. So saturated fats such as pork, heavy dose chicken, yes. And so we have to minimize the intake and lower the intake so that we are unlikely to have this condition called Alzheimer's disease. Also, we also have to prevent head trauma and then falls. So prevent injury to our head as best as possible. Also, we have to also have moderate intake of of actually vitamin um moderate intake of certain fatty foods, yes, certain fatty foods. And also we have to take in more of vitamin C, vitamin E, and then vitamin B6, vitamin B12, and folate, a lot of iron. So a lot of iron foods. So we're taking kontomiri. It's very, very important. It's very good to boost your immune system. Okay. As you mentioned earlier on, we are talking about some classical signs, the warning signs of this condition called Alzheimer's disease. So let's take notes of it. So we have about 10 of them. So the first one is that we have memory changes that disrupt our daily activities. So therefore, the individual forgets recently learned information. So if you teach a person something today, the next moment the person doesn't remember. Also the person continuously asks you questions. So if the person asks you question that what did you say, pardon, the person cannot remember what you said in the last few seconds. The person is likely to be having this condition called Alzheimer's disease. And also the person also relies on memory aids and then family members, and the person has a typical constant forgetfulness. Actually, this also could present itself with this condition called Alzheimer's disease. And also the person also has challenges in planning and then solving problems. So the person cannot plan, coordinate events to be able to carry out an activity. The person has cannot even follow cooking procedure to be able to cook food very well, and the person has difficulty in concentrating in carrying out activity, and actually takes a longer time in carrying out an activity. So if you ask the person that, maybe fetch some water for me into the bathhouse, the person could take a longer time even to think about taking the bucket, turning to the tap, and carrying it into the bathhouse. So there's a very reduced time, or the very, very reduced ability to concentrate in carrying out an activity. The person also has difficulty in completing tasks. The person starts an activity, but in terms of finishing it, the person takes a longer time and is distracted by so many things. And also the person is actually, if the person drives, the person has trouble driving, and then also recognizing familiar places. So when you present a person to a place for even 5 times, the person cannot remember on the 6th time that the person has gone to this place, and that is actually a very classical sign of this condition. And also the person has confusion with time and place. So if you ask the person that maybe this evening, to the person that are we in the evening or in the morning, the person says we're in the morning. So just imagine if I ask you that is it evening or morning, and you say morning, I'm surprised that we're in the evening and you're saying the morning. So the person has a classical confusion with classical signs of confusion with time and space. So if the person is in the hospital, the person says, I'm in my house. Just imagine. So these are classical signs of this condition. And also the person has trouble in understanding visual images and spatial relationships. So the person cannot read very well, the person cannot judge questions or various analysis being given out or being discussed. And also the person has visual changes related to cataracts. So the cataracts are actually a condition that affects the eye. So the person has difficulty in seeing very, very well. The person also has a problem with words and even speaking and writing. So the person also could stop in the middle of a conversation and become confused totally. Then he doesn't know how he started and how he ended. So the person also has trouble with vocabulary and then find out the right word. So if the person is supposed to complete the statements, the person can say, you said you are going to person cannot even understand and how to even continue what to say. And so this is also a classical sign of this condition called Alzheimer's disease. Also the person has a presentation of misplacing things and losing ability to retrace steps. So if you give the person maybe a remote like this and ask the person that person places a remote in front of you like this and leaves and goes back, the person cannot remember where he placed the remote. And so the person has a very, very short-term memory loss, and these are also classical signs of this condition. The person has excuses of actually remembering things, and then Actually, person misplaces things from time to time, from the keys, from the dresses, from the watch, from the earrings. So if you have someone exhibiting this sign, the person could have Alzheimer's disease or forgetfulness and confusion. Also, the person also has a sign of withdrawing from work or social activities. Actually, when the person in carrying out projects, the person withdraws himself and does not even intend to engage himself or herself in carrying out a group activity. The person also has changes in mood and personality. The person is suspicious and has also a sign of depression and also fearful and anxious, and always upset at home, with at home with friends and work 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 re- relations. Okay, and also we have, as we mentioned, we have two onsets of this condition. We have the early onset and the late onset. Actually, this is actually the two actually types of this condition, but then we have stages of this condition, how this condition progresses. The types and the stages are a bit different. So we have the early stage, and then the moderate stage and the severe stage. So the types are different from the stages. So the first one, the types are the early stage AD and then the late stage AD. But the stages of this condition, we have the early stage, the moderate stage, and then the severe stage. So early stage, actually the person may function independently and then do activities, carry activities of daily living, but actually may drive, may work, and then be able to partake in social activities. But the person has memory lapses, had difficulty in familiar with and locating objects when placed at a particular place, and has difficulty in remembering names of people and recently read materials. And the person also has difficulty noticing family members, friends, and actually even his or her doctor. And the person also has mild challenges in performing activities. The person has lack of spontaneity, that is, the person cannot carry activities as fast and as best as possible. The person has disorientation in time and space, so the person cannot remember even whether it's daytime or nighttime, or the person cannot even remember where he or she is at the moment. So this is the early stage of this condition. The second is the moderate stage of this condition, and the person has actually personality changes. The person has a little swift mood changes. Also, actually, this stage takes a longer time to become physically visible. Yes, and then the person has increased memory loss, so the person forgets actually at a higher rate, and the person has a personal history of inability to recall where he or she stays and some activities done in the recent past. Also, the person has decreased independence. The person could have difficulty in controlling his or her bladder or bowel, and has a risk of becoming lost and wandering within a region or an area. The person also can have dependency with choosing appropriate clothes. So the person is not comfortable in even making his or own decisions. And the person asks, "Oh, is this okay? Is this nice? Is this okay for me?" The person also has impaired cognition and abstract thinking. So the person cannot think well, and then the person has difficulty in imagining and then trying to put two and two together, has difficulty in doing that. So we're talking about the moderate stage of this condition called Alzheimer's disease. The person also has restlessness and agitation. The person is so anxious to complete a particular task. The person also has wondering. The person also is wondering that, oh, what will I do? Am I going? Am I doing this? Am I doing this? And also has an impaired judgment. The person cannot make conclusion in a very particular matter. The person has inappropriate social behavior. The person also has lack of insight. The person cannot even think afar, and also has a repetitive behavior and then a voracious appetite. The person likes food, it will eat raw. So if you eat and you like eating, that doesn't mean that you have this condition. There are so many factors that could present itself as you having this condition, Alzheimer's disease. And a very important and classical sign is where you have the memory loss. Okay, so the severe stage of this condition, we've talked about the early stage, we've talked about the moderate stage, and then that's the mild stage and the moderate stage. The severe stage of this condition called Alzheimer's disease, actually the person has decreased response to the environment and decreased ability to communicate, and actually may speak in small phrases. So he or she speaks as shorter sentences, so he can't, or he or she cannot complete a sentence as best as possible. The person has difficulty in swallowing, and then he has decreased vulnerability to infections, and so the person is likely to be ill at or at shorter intervals, and also has an inability to communicate, and also has urinary and then fecal incontinence, that is, he or she cannot control his or her bowel or bladder. And intermittently, that is, in between time, the person has seizures. Seizures are actually shaking of the body or contraction of parts of the muscles of the body. So we're talking about associated comorbidities, that is other conditions that could be included with this condition. Yes, we have one. We have glaucoma, that is an eye condition. A condition that affects the eye. Glaucoma. We have a vascular disease. We have thyroid disease that is affecting the neck region, and we also have sleep apnea. The person has difficulty in sleeping, and then also osteoporosis. That's a condition that affects the bones. So we have weakening bones. The person cannot be able to walk well, or even walk a shorter mile. Okay, so we also have cancer. Yes, and we also have a condition we call rheumatoid arthritis. That is a condition that affects the joint in the body, and also the person has depression. So aside this presentation, these associated comorbidities, and then these stages, we're talking about some medications and how they help in terms of this condition. We have one we call donepezil, we have rivastigmine, we have galantamine, we have so many. And these help in terms of memory and then to slow the progression of this condition. We have the memantine, and we have the taquine. Yes, these are all medications. We have so many of them to be able to slow the progression or the deterioration of this condition. So how do we recognize this condition? First of all, we seek the assistance of a neurologist or a neurosurgeon. We have a physiotherapist which helps in management of this condition. So the neurologist or the neurosurgeon or the physical therapist also has various classical tests that helps to diagnose this condition. So we have many mental tests, we have screening tests to go to diagnose this condition. Actually, research has also shown that we have something we call biomarkers, and actually this helps to recognize these proteins in the brain, because the brain doesn't have these plaques, that is these proteins in the brain. So when you have them coming into the brain and being visible, then we can see that the person is likely to be having this condition we call Alzheimer's disease. So these biomarkers actually help to identify this condition, but this is a research that is still being carried out, yet to be concluded or performed at a bigger platform. So we also have something we call neuroimaging. So we use MRI, we use CT scan to be able to see inside our head, that's the brain, and then we can see whether we have this protein, that we have the neuro fibrillary tangles, we have the senile plaques, and these could help us to be able to diagnose this condition. We also have something we call CSF, that is cerebral spinal fluid proteins in the brain. So when we have accumulation of them in the CF, then we can say we could have an early stage Alzheimer's disease or a late stage Alzheimer's disease, or a mild, moderate, or severe type of Alzheimer's disease. And this can also be done through a lumbar puncture. Lumbar puncture is actually, we have something we call a needle, like a syringe form, which we pierce at the back to be able to pull the fluid in the spinal cord region. And if you have these proteins, that is the senile plaques or the neurofibrillary tangles, then the person could have this condition we call Alzheimer's disease. So as research progresses, we are moving on to identify these specific genes. And so scientists have been able to identify 3 specific genes for this condition called Alzheimer's disease. And then we have the one we call amyloid precursor protein, that is APP protein, APP, or the presenilin protein, or presenilin 2 protein. These 3 proteins are very important to diagnose this condition. Additionally, we also have the apolipoprotein 4, and these are all genetic tests that when the biochemist or the medical laboratory scientist carries out and recognizes in our genes, we could have a likelihood of having this condition, or even passing on to our generation, our next generation. So there are classical criteria to both diagnose this condition. Actually, one, we have the structural imaging, we have the functional imaging, and actually these imagings are very important, and these are able to help us to able to determine the activity of the brain. We have something we call the PET scan, positron emission tomography, and this helps also to see or tell the brain activity, how the brain is functioning, if it's functioning well, it's functioning slow, and this could also infer and help us to diagnose this condition at an earlier stage. We have also the molecular imaging, yes, and then also we have so many imaging tests that we can, but the main ones are the MRI, CT scan, the PET scan. Yes, we can't use X-ray to be able to see the brain. The brain will be almost invisible. So when someone asks you to take an X-ray to be able to see your brain, the person is lying. You cannot see the brain with an X-ray. Okay, so some of the screening tools that a medical doctor or a physical therapist will ask you to, or will carry out for you, is one, we could have the mini cognitive test or the mini mental state exam. And these are all various questions that will be asked to you to be able to see how you remember things and how you're able to remember time. So it will ask you to draw a clock and then draw that it's 4 o'clock. If you're able to do that, then it shows that yes, you are able to remember things or able to apply or understand questions. Okay, so now we're talking about the causes, then we'll move on to the management, then the diagnosis, differential diagnosis. So the cause of this condition, actually we don't really know the cause, the actual cause, but then scientists are still making headway to be able to state what actually causes. We have proteins, which are actually mentioned earlier on, genetic testing, that are helping us to be able to treat this condition, but not yet. So early onset has been stated that it could be genetically related, which have not been stated very well. Okay, so we also have the environmental factors, such as we having abnormal motor signs, that we having shaking signs, we having tremors in our hands, and then in our arms, and then even sometimes in our legs. And also we have the postural impairment, that is when you're walking, the person is not able to walk well, and the person has balance impairment, that is instability in terms of walking, and then having disorders in sleeping, and then also eating, and then sexual satisfaction also. So then we move on to the medical management. So how do you manage this condition medically? Yes, actually this condition, we've been stating so far now that we have no cure, yes, but we have various modes of management, and that helps us to live 7 years plus, or sometimes 11 years or more plus. Okay, but we have this procedure helps us to maintain the quality of life, maximize function, also enhance cognition of the person, his ability to think very well, and also very well. Okay, so actually this also helps to improve the person's ability to remember things at an earlier stage. Okay, so treatment actually of this condition is aimed at, one, to increase the patient's comfort, two, security, and then ease of mind, most of the time the person becomes worried. Okay, so most of the time the person has this increased yeah, increased we are aiming at increase the person's or the patient's comfort and security and an ease of mind, so the person doesn't worry about so many things. And then also we encourage or engage the caregivers to ensure adequate support, and then also to avoid any likelihood of burnout. So it actually burdens the caregivers, so we encourage the caregivers not to burden themselves, and also provide resources to help the person to live independently. So then we move on to the physical therapy management, then the differential diagnosis. So the physical therapy management also is important. We also manage other comorbidities that we mentioned earlier on, as hypertension. So through exercise, physical activities as walking, and then moderate activities. Um, the walking should be done under supervision, because the person could be walking and then even forget his way back home. So because this involves memory loss, so walking helps to stimulate the brain neuron, that is the connections in the brain to join very very effectively, and this also helps the person to regain memory better. Also, we also encourage activities such as, we have a device we call upper ergometer cycle. So this helps to improve the hand function, and so if the person is not able to raise the hands or perform activities with the hands, the person is able to do so better with the use of the upper ergometer cycle in the physical therapy department. The person also involved is involved in group therapy. So other people having this condition, when the person engages in activities with them, there's more of a good interaction, and this fosters the improvement of the condition. Also, we also have horticultural intervention programs for older adults. So maybe backyard farm garden. So when the person engaging in this, the person is able to get better, as research has said. So aside the physical therapy management, we also have very important management, that's dietary management, because if you take in some foods too much, we could accelerate this condition to occur. It's important that we take in a healthy diet rich in vitamin C, in fruits, in omega-3 fatty acids, vegetables, and take in more folate diet. And this helps to reduce the risk of having this condition called Alzheimer's disease. Okay, also taking antioxidant, that is vitamin E, also has been shown by research that it helps to reduce the risk factor of having this condition. So we talk about the differential diagnosis, that's other condition that could look like this condition. We have the Pick's disease, we have the Lewy body dementia, the frontotemporal dementia, we have dementia from multiple medications, that is taking too many medications. Yes, so these actually are the differential diagnosis of this condition. So far we talk about dementia, that is being not able to remember things, and then getting lost, not being able to plan very well. That's some of the signs, and how to treat them. That is through medications, through physical therapy, and then through diets, what we eat very 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 effectively. When we eat well, we're able to prevent this condition from occurring as early as possible. Okay, so I'm sure you've learned a lot. We've had a number of people joining in the presentation, so just a short pictures to be able to see how this condition. So just a minute. Okay, so we look at some of the pictures very soon, in about a minute, just a minute. Okay. So pardon me, just a minute. Okay, right. So this is actually what we're talking about. Yes, The Alzheimer's disease. I'm sure the light is not so is blurring. Okay. Okay, so this is the brain. Yeah. I'm sure you can see it now. Um, yeah, this is the brain. This is how the brain looks like. We have the yes, the hippocampus. So this is the brain. They have this is called the medulla oblongata, cerebrum. This is medulla oblongata, cerebrum, and cerebellum. Okay, so this is someone who has, you see, this patches means not being able to remember things very well. This is like a puzzle that has been shuffled. So the person is not able to coordinate things and remember things. Is the person is thinking. You can see it from this place. The person is thinking, trying to remember things and bringing things together, but has difficulty in doing so. So we can see now, as written here, is the most common cause of dementia. So they are related. Alzheimer's disease, and then involves damage to the brain cells. Okay, so these are some of the early signs of this condition. We talked about it earlier on. Yes, okay. So you can see these are also a short flyer showing this condition. Yes, the person has. These are some of the things that the person should do to prevent this condition from occurring: eating well, engaging activity, physical activity. Okay, so this is an old woman having this condition. So I mentioned about gyrus and sulcus. So these are so when they become reduced in terms of, you see, this is a normal one. You can see it here. But if you see, this is the sulcus. If you compare this one, I'm sure you can see it. If you compare this one and this one, you could see a very, very, very wide difference between the two. Okay. So this is the normal sulcus. You can see the very good here, and this reduced one, you can see that it's reduced all compared to this one. And this one here, look at this, very normal here, but if you look at, there's no space here. But when you look at here, there's space here. So the person cannot be able to remember well, and the person cannot communicate well. And also look at the memory here. This one here, you see, this one here is almost deteriorated, it's absent. Okay, so these are some of treatment. That is genetic testing. So we're able to test the rate of progression of this condition. This is the person can't remember anything at all. Okay. So this is also an MRI of the brain. You can see the very good and normal one here, and then the mild one, you can see the space here becoming bigger. This is the worst form. You can see the very big space here. So with the MRI, you can see it's very, very effective. You can diagnose this condition as best as possible. So you can see the brain differences here. You can see it here. Yeah, you can see the difference. You can see a normal brain, a progressively worsening one, and this is, you can see the patches here that show that the condition has deteriorated. Yes. So this is a graphical representation of this condition. That was a research carried out. So there's an old one having this condition. Yes. So we have World Alzheimer's Day. So these are the stages of this condition, from the dementia, that's forgetfulness, to the Alzheimer's disease. Okay, so you can see the brain here, old woman. So these are some of the clinical symptoms of this condition. We talked about it earlier on. We've talked about it. Yes, the mood swing, the misplacing long belongings, difficulty concentrating, carrying out simple tasks. Yes, the person 2+2, the person cannot remember, cannot even understand it. It's an old woman. Okay, yes. So this is the brain, MRI of the brain. Okay, so these are some of the things the person should do: the eating well, exercising, leisure activities, social engagement, mental activity. So Okana study has shown that about 65 in every 65 seconds, someone develops this condition in America. That's America, not Africa. Okay, these are some of the amounts of money that is spent in taking care of this condition. About $244 billion. Okay, so yes, so these are some of the pictorial presentation of this condition. So about 1 in 3 seniors die out of Alzheimer's disease in America. So this also some of the early signs of this condition: confusion with space, memory loss, poor judgment, hard to complete familiar tasks, and then changes in mood. Okay, these are also symptoms of Alzheimer's disease. I'm sure we've discussed it earlier on. Okay. All right, all right, all right, all right, all right. I'm sure we've learned a lot. We've learned a lot. Okay. Yes. Yes, I'm also sweating. Yes. Thank you very much for your time. Yes, it's been a very hot time, a very hot day, and I'm sure you've learned a lot. You've learned a lot, and we are likely to to share what we've learned to our various friends and loved ones. Yes, thank you very much for your time. I'm very grateful, and so we acknowledge this. Some people who are watching, I'm sure some people join out, and Franklin, Joanne, Kwabena, Ebo, Philip, Georgina, and quite a number of people who went in and out. I'm sure the lights out didn't permit us to continue, but thanks be to God that we have come to a blessed conclusion. Thank you very much for your time. If you have any question, you can pose and you can ask it on the page, and then it will answer it accordingly. Without any further questions, and then we proceed to our next topic. So next week we'll be talking about very important condition also, and this one is not the brain, it's not the lungs, it's not our shoulder, but actually our hand, our arm. So it affects our arm. It's called Colles fracture. So let's stay tuned till next week. May the good Lord be with us. May the good Lord take us through this week. Have a blessed holiday tomorrow. Take care. Goodbye.